Hi, you all. My name is Velvet Reed, and today I want to talk about a lack of prenatal care. This is actually part of a research assignment which I had to do for a health education class, and I thought what a perfect opportunity to educate people on prematurity. A lack of prenatal care is a huge risk factor for preterm birth. Secondly, prenatal care is imperative to all expectant women. And thirdly, I wanted to get to the bottom behind the lack of prenatal care. So I put together some slides along with my research, and I hope you guys enjoy. Thank you. Let's talk about the importance of prenatal care. Essentially, prenatal care is a preventative method which provides expectant mothers support while monitoring both mother and baby throughout the duration of her pregnancy. During a prenatal care visit, interventions can be recommended if needed to improve maternal and birth outcomes. For example, let's say a mother has high blood pressure and she is on hypertensive medication. During her prenatal care visit, her doctor could essentially readjust her dosage of her medication to best suit her and her baby. Thirdly, prenatal care is essential during pregnancy because it helps prevent complications, including preterm birth. Pregnant women who do not receive prenatal care during the first trimester or too late into the pregnancy are at higher risk for preterm birth. Preterm birth is any pregnancy delivered before the 37th week of pregnancy. The power of communication. One conversation can change a life and save a life. Communicating with healthcare providers enable required testing such as, but not limited to, blood work, blood pressure, sonograms, vaginal sonograms. A lack of prenatal care increased the risk of maternal women going undiagnosed for previous or existing health conditions, which are contributing to preterm birth. Now, if there's a lack of prenatal care, there's also a lack of communication and a lack of conversation. During a prenatal care visit, an expectant mother is not only exchanging her health history, but she is also acquiring new health history because she is receiving blood pressure tests, blood work tests, sonograms to check on her baby, vaginal sonograms, and she is also being educated on how to increase positive outcomes for her and her baby. During my research, I came across several reasonings why women were no longer seeking prenatal care. However, the number one reasoning behind the lack of prenatal care was mistreatment. Pregnant women were reporting being shouted out by the healthcare providers. Healthcare providers were either ignoring or refusing their requests for help or failing to respond to requests for help in a reasonable amount of time. There were some reports of violation of physical privacy, or healthcare providers were threatening to withhold treatment or forcing them to accept treatment that they did not want. There were some reports of pregnant women feeling a disconnection between them and their healthcare provider, which ultimately made them feel as if they had no say-so in their care. Healthcare providers were not providing full routine care due to racial and socioeconomic status. There was also some reports from several population groups whereas they were receiving partial testing and partial care, whereas some women in higher socioeconomic status were receiving the full care. Ultimately, this led to a fear of them experiencing the following mistreatment, which is driving pregnant women to reduce prenatal care, which is increasing the risk of preterm birth. According to my research, the population affected the most is non-Hispanic Black women ranging from ages 15 to 44. According to the National Health and Nutrition Examination Survey data, preterm rates to non-Hispanic Black mothers were approximately 50% higher than those birthed to non-Hispanic whites and Hispanic women in 2020. We're going to talk about some interventions aimed to improve prenatal care according to the World Health Organization, who sees a future in which every pregnant woman and newborn receive high quality care throughout their pregnancy, childbirth, and postnatal period. Effective delivery techniques. According to the World Health Organization, there are 8 standards that were put into place to ensure all expectant mothers and newborns will be accessed, improved, and monitored within the health system. Their overall goal is to ensure high-quality care for all. On this slide, I briefly mention all 8 standards that were implemented according to the World Health Organization. I'm not going to read through all of them, but I do want to touch on Standard 4 and Standard 7. If you recall, I mentioned how important communication is and how powerful it is that it can potentially save a life. Standard 4 says communication with women and their families is effective in response to their needs and preference. If you recall from the reasoning behind a lack of prenatal care is mistreatment, a lot of expectant women were feeling as if they were not being heard, they were being ignored, and not effectively responded to in an appropriate amount of time. Standard 7, for every woman and newborn, competent, motivated staff are consistently available to provide routine care and manage complications. Another amazing intervention is prenatal care via telehealth. This was actually implemented during COVID, which it creates a virtual space for healthcare providers and maternal women to monitor the health of the mother and the baby. Now, this is still an option in 2024. However, it does not completely rule out in-person OB visits, but it does decrease the visits and create flexibility for the maternal mothers. Now, if you look at the picture in the background, it's a expectant mother in the comfort of her home. She does not have to worry about being mistreated. She does not have to worry about being ignored. She does not have to worry about services being refused to her. She's in the comfort of her home, on her phone, on her laptop, and she can talk to her healthcare provider and monitor the baby more at home opposed to being in person for every visit. Now, according to my research in an article, Prenatal Care via Telehealth, published on National Library of Medicine in 2022, it mentions there are 8 in-person physician appointments, 6 virtual visits with a nurse, access to an online community of other pregnant women, and supplies are also supplied to the patients such as a blood cuff and a fetal Doppler. Compared to usual care, patients had a higher satisfaction rate, decreased pregnancy-related stress, increased duration of breastfeeding with no difference in perceived quality care. While these are not required interventions to ensure a healthy pregnancy, these are my personal recommendations that I feel is a plus to ensure, being active and have a positive outcome throughout your pregnancy. Expectant mothers can download pregnancy apps that show weekly gestational development and nutrition recommendations. Expectant mothers can use their phones to track how much they walk while monitoring heart rate and blood pressure. And any expectant mother still experiencing mistreatment and mishap during prenatal care visits are recommend to change their primary care physician or file a complaint with the Department of Health. If you look to my left side, it has a visual of some of the benefits that come with downloading the pregnancy app. You can see what's happening in your body. You can see what exercises are suitable for pregnant women. You can reschedule medical appointments. You can time contractions. It also shows the fetal growth from the first week to the last week, which I think is really cool. It also has a 3D animated visual of how your baby is growing from the first week to last week. So if you are pregnant and you are looking for extra ways to make sure you're being healthy, monitoring yourself and baby, I highly recommend downloading one of the pregnancy apps. If anyone is interested in doing a deeper dive behind a lack of prenatal care, here's my reference page and some of the sources I used to write my 5-page paper on lack of prenatal care. I hope you guys enjoyed my slides, enjoyed my visuals, and like and subscribe. Stay tuned for more on prematurity.